Hello, everyone, and welcome to our webinar for the Scope of Practice Standard. We're seeing a number of participants still logging in, so I'm just going to give it another few moments and give people time to log in. Great. I still see a few people logging in, but I think it's okay for us to get started here and then start the introductions. So good afternoon, and thank you everybody for joining us today to our webinar for CNO's new Scope of Practice Standard. My name is Alison Knoll, and I'm an advanced practice consultant with the College of Nurses of Ontario. And I'm joined today by my colleagues, Kathy Trissini, Catriona Mill, and Elizabeth Almeida. We're pleased that you're joining us today, and we will be trying to make this webinar a little interactive with some Zoom polls throughout. And of course, we'll open it up for questions and answers at the end. So have a little patience with us with our trying out our Zoom polls. And then when we open it up at the end, you can be asking questions throughout the presentation in the Q&A section, but we'll address them all at the end in an open session. Next slide, please. So before we begin, I would like to start with our land acknowledgement statement. CNO operates on the traditional, ancestral, and unceded territories of many Indigenous communities across Ontario, which continue to be home to Indigenous peoples. CNO's office is in Toronto on the land of the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. While we're meeting today in a virtual platform, I'd like to invite each of you to reflect on the lands where you're located and acknowledge the Indigenous peoples who call that area home. Next slide, please. Great. So in this webinar today, we're going to cover CNO's regulatory role in setting practice standards. We're going to speak a bit about modernizing practice standards at CNO. We're going to talk about the key features of our new Scope of Practice Standard. We're going to have a section on applying the new standard, and then we're going to open up to questions and answers. Next slide, please. So we're going to start with our Zoom poll just to get us all set and practice just with a warm-up exercise. And so we'll get Anthony to launch our Zoom poll. And really with this first one as a warm-up, we're just asking everybody how many years you've been practicing nursing to get a sense of our audience. And we have an option available for those who may not be a nurse. So we'll just give this a few minutes as a practice and a trial and see and share everybody's responses. All right, so it's great to see today that we have a range from all areas represented, but particularly our 20+ years. So that's great. I won't comment which area I'm in, but good to see that representation across so that we have perspectives from all areas of nursing and as non-nurses as well. So thank you very much for participating in that. So we'll just go on to our next slide and into the presentation. So first, we wanted to start out by just giving a better understanding of CNO's practice standards as a framing for the presentation. So CNO's mandate is to protect the public by promoting safe nursing practice. One of the ways we fulfill our mandate is by developing, establishing, and maintaining professional practice standards to ensure all nurses practice safely and competently. These practice standards set the benchmark for safe nursing practice. They inform nurses of their accountabilities, and they educate the public on what to expect of nurses when receiving care. And these have to cross all settings and all nursing roles. Next slide, please. So here is a snapshot of our modernizing standards framework. You'll note that the code of conduct, which has recently been revised, is the center, as it's our central overarching standard. It describes the core behaviors and conduct expected for all nurses in Ontario, regardless of role, title, or practice setting. The lighter blue section of the wheel shows new practice standards. This reflects the new scope of practice standard that we'll be discussing today. As we make changes to the standards, the model will evolve. As part of the modernizing process that CNO is doing, we're reviewing all of our standards and guidelines, and you will notice some recent retirement of standards as well as new and revised standards. In the framework, you'll also see that the foundation for all of our practice standards are based on entry-level competencies. And in the outer layer are the objectives of modern standards, which is accessible, defensible, and relevant. And so this means that the standards are clear, they're evidence-based, and they're relevant to current practice. Next slide, please. As we noted, part of the process for developing the scope of practice standards included reviewing all of our existing practice resources to integrate relevant content to ensure a modern standard is clear while reducing duplication across our resources. As part of this work, we've mapped and integrated relevant content from existing standards and guidelines, including the Decisions About Procedures and Authority practice standard, the Authorizing Mechanisms practice guideline, and the RN and RPM practice, the Client, the Nurse, and the Environment guideline. The scope of practice standard does not represent new information for nurses, with the minor exception of the recent changes for RPN initiation, but it includes legislation and relevant content from CNO's practice standard, the Decisions About Procedures and Authority, and content from those two guidelines. Also, a recent change to note is that relevant content from the following standards, which are ethics and professional standards, have been integrated into the new code of conduct that we mentioned has recently been revised and was launched on June 5th. Next slide, please. So the purpose of the new scope of practice standard is to outline the legislative scope of nursing practice and other key requirements when a nurse is deciding whether to perform an activity for safe client care. With current regulatory changes, the expanded nursing scope of practice with RPN initiation and the proposed changes with RN prescribing, CNO prioritized the development of this practice standard to support safe nursing practice in Ontario and system readiness when regulation changes take effect. A key learning from the COVID-19 pandemic demonstrated the importance of nurses being able to understand and work to their full scope of practice. Using the training and expertise of nurses more effectively is vital to make healthcare more accessible to clients and to lessen the pressures on the healthcare system. Through the development process, we went through significant internal review as well as external review from two separate legal counsels. And as many of you are aware, we also sought feedback through an external public survey in April. We want to thank all of those who participated in providing this feedback, as it helps inform CNO and the work of modernizing our standards. Now I will hand the next part of the presentation over to Kathy.
Thank you, Allison. Next slide, please. So as mentioned, the scope of practice standard outlines expectations and accountabilities based on the following concepts: authority, context, and competence. Each concept includes a list of nursing accountabilities. Nurses should carefully consider each of the concepts to help them determine whether they should perform an activity. Next slide, please. So first, about authority. Nurses are accountable to practice in compliance with the regulations under the RHPA and the Nursing Act, as well as comply with all relevant practice-based legislation. So nurses must ensure they have the legal authority prior to performing any activity. This includes assessing whether the activity falls within one of the controlled acts authorized to RNs and RPNs, whether the appropriate authorizing mechanisms are in place, or whether the activity can be initiated independently without an order in that practice setting. The exceptions to the controlled acts from the legislation are also listed in the scope of practice standard. And more detailed information on legal authority is included in the appendices of the scope of practice standard as well. Next slide, please. So context includes the broader environment in which nurses work, including the available resources to support nurses and their clients. A nurse who has the legal authority to perform an activity must also consider if it is appropriate to do so within the context of their practice setting. So in that way, nurses must understand the parameters of their workplace and be familiar with their employer policies and procedures, work collaboratively with other members of the healthcare team, make sure they are aware of and understand how to access available supports and resources to provide safe client care, and ensure to comply with all safety requirements. Next slide, please. A nurse who has the legal authority and has assessed the context of their practice setting must also ensure that they have the competence to safely perform an activity. So in addition to having the knowledge, skill, and judgment, a nurse must also assess that the client's condition warrants the performance of the activity, that the activity is based on the best interests of the client and includes the client's wishes. And if needed, consult or transfer care to another care provider for safe client care. And if needed, refrain from performing any activity that they do not feel competent to perform and escalate to an appropriate healthcare provider. And in all situations, nurses must reflect, identify learning needs, and continuously seek out and integrate learning to improve their knowledge, skill, and judgment in relation to their practice, and participate in CNO's quality assurance program. Next slide, please. So that was our very brief overview of our new scope of practice standard. So we now thought we would use a Zoom poll to provide some examples of some of the questions that we receive in our practice support team and how the scope of practice standard can be applied. So this is a new approach for us, as Allison had mentioned. So please, thank you for your patience, but we will try. So could we launch the first Zoom poll? Okay, great, thank you. So the first question is, how does a nurse decide whether to perform an injection? That's the question. And now a Zoom poll will come up and we'll give you a minute to just complete your response. Once we have all the responses, we'll show the results. Thank you. So, sorry, I should have included, and my apologies, in the answers that you were to check all that apply. So my apologies. So that probably created some confusion. So this is our learning, my apologies. So yes, all of the answers are correct. And thank you everybody for participating. So I'll just have you close the poll. Thank you so much and continue. So just for this example, sorry about that, nurses have access to the controlled act of administering a substance by injection with an order that is a direct order or a directive from an authorized provider, which could be a nurse practitioner or physician. In addition, a nurse must determine whether they are able to perform an injection in their practice setting. So to clarify again, even if a nurse has the legislative authority to perform an injection, they must also ensure that that activity aligns with employer policies. Employer policies may limit the activities a nurse can perform and where within an organization. And finally, a nurse who has the authority to perform an activity and has assessed the context of their setting must also ensure they have the competence to perform an activity. This includes assessing their individual knowledge, skill, and judgment to perform an injection and to seek help if they do not feel they can safely provide care. So thank you for that first attempt. Let's try a second poll question. So I am an experienced nurse and have decided to change jobs. I will be moving from a community organization to a hospital setting. Which of the following apply? So check all that apply. And here's the Zoom poll, thank you. And yes, please check all that apply. And again, we'll give you a few minutes to complete this. So we're just giving you time to complete the poll, and the results will come up once we've received all our results. And here are the results. So excellent. So 95% of you thought that you can perform a controlled act with an order and that you're accountable to your employer policies and procedures. And a small percentage of you thought that you could initiate wound debridement. So this was a little bit of a trick question. So in this instance, thank you. I'll just close the poll. Thank you, everybody, for participating. In this instance, although a nurse has the knowledge, skill, and judgment, and may have had the authority to debride a wound in the community center where they used to work, they cannot initiate debridement of a wound in a hospital setting. This is where the practice-based or setting-based legislation comes into effect. The Public Hospitals Act does not give nurses the authority to initiate controlled acts in a hospital setting. So in this situation, a nurse would need an order from an authorized provider, again, a nurse practitioner or physician, to debride a wound in a hospital. And again, the third one is correct in all situations. Nurses are always accountable to their employer policies and procedures. Thank you for participating. I have one more Zoom poll, if you wouldn't mind pulling it up. How can the scope of practice support employers? And I'll get the Zoom poll up. Again, give you a few minutes. In this case, please check all that apply. And again, once everybody has responded, we will see our results. Thank you. So just looking at the poll results, the majority of people thought all of the factors applied, which is the correct answer. Actually, all of those points do apply. Thank you for participating. And would you mind just taking down the poll? And we'll just continue. So just a reminder that client safety is a shared responsibility. And employers have the ability to determine the roles and responsibility of their staff and outline other detailed requirements. So for example, A setting or employer may have specific documentation or medication practices in their policy that meet the needs of their setting, but also align with the standards of practice and safe client care. The scope of practice standard may also support employers in making decisions about the structure of their nursing teams. Thank you, everybody, for participating. And next slide, please. So to help socialize the new scope of practice standard and provide additional support for stakeholders, new resources and educational tools will be developed, including short learning modules. We will continue to engage with stakeholders to ensure your needs related to the new scope of practice standard are being addressed. Future work will include integrating any legislative changes to RPN, RN, and NP scope of practice as appropriate. Next slide, please. And before we wrap up, we wanted to take this opportunity to highlight some additional resources you can find on our website. Our Ask Practice FAQs are created from commonly asked questions we see through our inbox. Our educational tools include webcast learning modules and other helpful tools. Our quality assurance resources includes FAQs about our quality assurance program, learning plan templates, and videos of how to become a reflective practitioner. And if after today you still have practice-related questions, feel free to complete a practice support form, and one of our advanced practice consultants from our team will respond. And lastly, please don't forget to follow us on social media. This is where we can stay on top of the latest work we're doing, but also to share your thoughts and have a conversation with us about how the latest information relates to your practice.